Okay, this video is chapter 7 from this book, Dr Mcdougall, The Doctor Who Fought for You, written by me, Pete Rogers. The chapter name is called Digestive Tuneup. It's about a book written by Dr. Dr Mcdougall. Here's the book. By the way, I also made a recent video about Dr. Mcdougall with regard to gastroesophageal reflux. I will put a link to that in the description. This is a good book. It's real easy to read from start to finish. You basically start from the mouth, go to the butt, all the common digestive diseases. Okay, so here's a quote from Dr. Mcdougall. Prevention is always the preferred option. I'm the luckiest doctor in the world because my patients regain their lost health and appearance by following the simple, cost-free, side effect-free dietary and lifestyle advice that I prescribe. Then he continues. The food you put into your body is the single most powerful factor that determines your health and well-being. I will tell you my story, how I was transformed from a chronically ill young man to a person who could be considered the picture of health at the age of 59 years. Born in 1947. This is Dr. Mcdougall continuing. I regularly windsurf in the deep blue ocean and strap my grandson into a backpack and carry him on mountain hiking adventures. And these are just page numbers from the book. Okay, through dietary change, patients have experienced lower blood pressure, relief from headaches, arthritis, pain, and even in many cases, complete healing of diseases like type 2 diabetes, obesity, rheumatoid arthritis, heart disease, actually reversing atherosclerosis without medication. Dr Mcdougall from Gastrointestinal tuneup. Yeah, the low-fat vegan diet without any oils, it's the most powerful thing in all of healthcare. There's nothing even close. And there's a simple reason for that. It's what humans are designed to eat. It's a species-specific diet. And I know some people contest that. That's because they have to contest it. If the public actually learned this, then they wouldn't be fat, sick, and stupid, and you couldn't make money off them, okay? I'm 60. I don't take any pills. I don't have any health problems. Okay, this painting here is Gulliver and the Lilliputians by Johann Weber from 1900. The difference in the healing ability for chronic Western diseases of a doctor who knows nutrition and epidemiology versus a regular doctor is like the difference between a Gulliver and a Lilliputians. And when Gullivers come along, they hassle them and try to tie them up, all the Lilliputians, okay? They block them in every way they can. They don't want this information getting to the public. And then I know all the public's confused because there's all the contradictory stuff on the internet. So it's hard to sort through all the nonsense for most people. All right, anyways, the book continues. Food is the major determining factor in how we smell to other people. So if you're eating, all the animal foods, they putrefy and they smell. It comes out in your bad breath. And the sulfur goes through your blood, from your gut to your blood. So as Mcdougall says, if you eat it, you ooze it. And there's no escape from that related to the increased amounts of the sulfur-containing amino acids in animal foods like methionine and cysteine. Okay, Mcdougall continues. Dairy, especially the dairy protein. So this occurs with low-fat dairy and skim milk. It paralyzes the bowel intestinal muscles of peristalsis, and this leads to constipation. Dairy causes so many problems. It's very sneaky. So it causes constipation. It also causes autoimmune disease. It's associated with type 1 diabetes from autoimmune disease, multiple sclerosis from autoimmune disease, increased risk of cancer, and with other diseases. It's much worse than people realize. Okay, high-fat diets are associated with heartburn. Excessive dietary fat can cause heartburn, peaks 3 hours after a high-fat meal. Other causes of constipation are calcium channel blockers, excessive psychological stress. Stress shuts down the blood flow to the gut. Okay, eating more plant foods, which provides more dietary fiber, helps to prevent constipation. When making the diet change from SAD diet to plant-based diet, one can drink some prune juice to initially alleviate the constipation. If a person should need a laxative, then lactulose is the best one. Mineral oil is okay for treatment of constipation. I'm just reading things that Dr. Mcdougall had recommended. Okay, coffee, including decaf, increases the risk of lower esophageal sphincter dysfunction and gastroesophageal reflux. So lower esophageal sphincter is where the esophagus connects to the stomach. Cigarettes and alcohol also cause lower esophageal sphincter dysfunction and GERD, gastroesophageal reflux disease. Over 90% of gallstones are cholesterol gallstones. The higher the amount of animal foods, the higher the amount of gallstones. Here's a drawing of just what leaky gut looks like. So basically, under normal conditions, you've got a single layer of cells called the epithelial layer or the enterocytes. The gut is the enteric tract, so the gut lining cells are called the enterocytes. They have tight junctions between them, TJ there, the red things, and that prevents toxic substances and bacteria from getting through the gut lining. Fiber goes to the good gut bacteria. I got them drawn here with smiley faces. They're happy because they get the fiber and then they make that into short-chain fatty acids, SCFA. The most important one is butyrate. Butyrate is used by the gut lining cells to make the tight junctions. As a matter of fact, butyrate goes into the blood and then it goes up to the brain and it's used to make the tight junctions of the blood-brain barrier. But these are super important, these tight junctions. If you don't have enough fiber, or if you have these other problems that can damage the gut wall, you can get increased gut permeability. That's called leaky gut. And then you can get bacterial endotoxins passing through this gut lining. LPS is lipopolysaccharide. It's a gram-negative endotoxin from gram-negative bacteria. So there's LTA is lipoteichoic acid. That comes from gram-positive bacteria. Anyways, when it gets across the gut lining, it'll cause localized inflammation. It can get into the blood and increase the risk of clotting. Big gaps in the tight junctions will allow chunks of animal protein to get through. And the animal protein is different enough from our own bodily proteins that the immune system will react to it, but it's similar enough that those same antibodies which have reacted to it might cross-react and attack things in our own body. That's called autoimmunity, autoantibody cross-reactivity. Well, molecular mimicry in the sense that the animal protein to some extent mimics our own bodily proteins. And then antibodies that attack our own body are called autoantibodies. And in a sense, because they react to this and now they react to something else, it's called cross-reactivity. So molecular mimicry with autoantibody cross-reactivity, sort of the fancy way of saying the whole thing. Okay. Okay, Dr. Mcdougall continues. Mild chronic colitis is most often referred to as IBS, irritable bowel syndrome, and it equals abnormal bowel function with episodes of diarrhea and constipation. IBS is the most common cause of referral to a gastroenterologist, probably about 50% of their visits. The most common cause of irritable bowel syndrome is milk, like with the lactose. Also, wheat, eggs, and a high-fat diet. For irritable bowel syndrome, the Mcdougall diet is usually a good treatment. And again, I put the page numbers from the book. Okay, inflammatory bowel diseases, including ulcerative colitis, Crohn's disease. Inflammatory bowel disease is found exclusively in persons eating a Western diet. So he's basically saying that it doesn't occur in the non-Western populations. Inflammatory bowel disease is more common in northern populations because they eat more meat and dairy. Crohn's disease patients can have 20 stools per day. They tend to find relief from watery stools with the Mcdougall diet within 3 days. So listen to that. He's saying you can usually get better from Crohn's in 3 days if you eat the Mcdougall diet. That's rather extraordinary because a lot of patients never get better. They have tons of problems, tons of complications with Crohn's and ulcerative colitis. So here Mcdougall continues. Patients with ulcerative colitis and Crohn's greatly benefit from a low-fat, plant-based diet. The best way to prevent and treat all forms of colitis from mild to severe is to eliminate all free fats, vegetable oils, and animal products. So no oils and nothing from an animal. That's a key thing to do if you want to get healthy. And begin consuming starch-based diet with fruits and vegetables. If that doesn't work, then eliminate all wheat products. Offending foods can be, for celiac disease, can be barley, kamut, rye, triticale, wheat, semolina, durum, bulgur, seitan, beer, ales, malted drinks. Okay. Foods acceptable for celiac disease are rice, millet, some oats, buckwheat, kasha, corn, quinoa, potatoes, sweet potatoes, legumes, green and yellow fruits. So it's a little bit of an elimination diet there for some patients who might have a celiac sensitivity and whatnot. Okay. Next he talks about colon polyps. Colon polyps are a cellular proliferation of mucous membrane in response to constant irritation. So yeah, a lot of people will see those go away if they stop, eating a lousy diet that irritates the gut. Irritation leads to cell proliferation, and this leads to small polyp development. Small polyps grow into larger polyps. With large polyps, some cells turn into cancer. The larger the polyp, the farther along it is towards becoming cancer. Colon cancer risk is strongly linked to diet. The SAD diet is high risk for colon cancer. The low-fat plant-based diet is low risk for colon cancer. Animal fat, cholesterol, and animal protein all increase the risk of colon polyps and colon cancer risk. Sulfur amino acids lead to increased hydrogen sulfide in the colon, which is toxic to the gut wall. Increased dietary fat leads to increased bile acids in the colon. The liver has to secrete more bile to digest the fats. The lack of fiber leads to bad gut bacteria that produce chemicals toxic to the gut wall. Fiber is converted by good gut bacteria into butyrate, and this inhibits the growth of colon cancer cells. So yeah, colon cancer, the butyrate not only protects your gut wall from leaky gut by making the tight junctions, it also helps inhibit the growth of colon cancer cells. So it's pretty valuable. Just increasing our dietary fiber by 13 grams per day is thought to reduce the risk of colon cancer by 31%. There is substantial evidence that a low-fat, no-cholesterol diet can slow the growth of colon cancer and allow a person to have a longer, healthier life. So stop eating animal foods and oils, and stop throwing gas on the fire. Okay, then there's the stereotype characteristic gallstone patient. Fat, female, fair, fertile, flatulent, 40, all associated with increased risk of gallstones in the gallbladder. About 30% of Americans over 60 years of age have gallstones, and about 1% of them have serious symptoms, so most of them don't. Gallstones are usually cholesterol gallstones, at least 90%. The bowel becomes supersaturated with cholesterol, and it precipitates to form cholesterol stones. Cholesterol only comes from animal foods. When the gallbladder is surgically removed, it's called a cholecystectomy if they take it out, the bile has nowhere to be stored, so the bile continuously, slowly drips into the small bowel. This can lead to irritation of the colon and diarrhea. This can also lead to increased risk of right-sided colon cancer. If you have asymptomatic gallstones, it's best to leave them alone and just eat the McDougall diet. Yeah, that's true. I see gallstones all the time. The vast majority of them are asymptomatic. Okay, what do you think causes the liver to be infiltrated by fat? The same thing that causes fat everywhere else, eating fat. The idea of good fats is toxic. Don't buy into this good fat stuff. So-called good fats increase your risk of obesity and cancer. Yeah, there's a lot of hyping of fats. It's not true. Low fat is the way you want to go. For patients with liver disease, a low-protein diet is easier on the liver. Plant proteins are easier on the liver. Subcutaneous lipomas sometimes decrease when the patient loses weight. Cellulite does disappear with weight loss. Acne does not occur in teenagers where people eat low-fat diets. So the low-fat diet protects you from a lot of things. And that was from a video called How to Prevent Fatty Liver by Dr. Mcdougall. There's also, this Dr. Mcdougall newsletter, My Stomach's on Fire and I Can't Put It Out. Detailed discussion of GERD. Yeah, and I made a video about that with reference to Dr. Mcdougall's YouTube channel. I will put a link to that. So anyways, that's from his Gastrointestinal Tune-Up book. Hope that was helpful.